human body was meant to move. In fact, when you stop moving, you start dying almost immediately. It doesn't matter what age you are. As soon as you stop moving, you start dying. When I operate on my patients, even on their spines, I have them walking the day of surgery. They come out of the OR, they recover from anesthesia, and I want them up and walking because their wounds heal better when they walk. It's counterintuitive, right?
We are living longer than ever before, but somehow people seem to be getting sick earlier. Fatigue has become normal, poor sleep has become normal, stress, weight gain, diabetes, inflammation, all increasingly normalized. And the uncomfortable question is, are we actually getting healthier or just surviving longer? Today on Brighter 100, we're exploring why chronic disease is exploding in the modern world and what people can actually do to prevent, manage, and reverse it. Joining me today is Dr. Ravi Kumar, a board-certified neurosurgeon who, after years inside modern medicine, began asking deeper questions about metabolism, inflammation, lifestyle, and the future of human health. This is not a conversation about hacks or trends. It's about understanding what's really happening to our bodies and how we can reclaim our health span. Dr. Kumar, welcome to Brighter 100. You've spent decades in one of the most demanding fields in medicine, neurosurgery. What does working that closely with human body and disease teach you about health? Because I imagine when you operate at that level, none of us would be able to look at things the way you do. So it would be interesting to get your perspective.
Yeah, well, I mean, you realize how delicate the human body is, but also how resilient it is. And, the organ system I work with as a neurosurgeon is the central nervous system. So that's the brain and the spinal cord. And literally millimeters of error or a small judgment call that didn't go the right way can cause someone to die, to be paralyzed, to be in chronic pain for the rest of their life, for their personality to change. These are like massive life-changing complications that happen from tiny little errors. So in the field of neurosurgery, we have to deal with that. And it really makes you realize how basically delicate the human body is, especially the brain and spine. Now, that being said, I've seen patients with horrible complications who have made completely remarkable and almost miraculous recoveries, going from, basically being in a coma or paralyzed to being awake and functional in the world or walking again. It really gives you a good appreciation, though, of how delicate we are and how much capacity we have for healing.
Right. But you've done so many surgeries. What drives some people to recover really well and some people just simply struggle or even fall off?
Yeah. Well, I mean, there's a number of things. One is the unmeasurable, Anil. I mean, there's things that they're intangible, right? And you can see someone and you can see that, hey, this looks like a resilient person. And they often do recover much better, much quicker, and you can't measure it. Okay. But there are things you can measure, like metabolic health. If the person has a low BMI, that's body mass index. It's a measure of how much you weigh compared to how tall you are. If they have a lower BMI, if their hemoglobin A1C is in a normal range, which means they're not diabetic or pre-diabetic, if they're young versus old, if they have social support system around them, and people who love them, people who help them, those people all do better than if they are diabetic, obese, generally just look like they have not been resilient in life, or if they don't have social support at home. Or if they have drug or alcohol addictions, those people generally do much worse than the other group I talked about.
Early in your career, did it feel like modern medicine was steadily moving society towards better health? Because I'm sure there was so much optimism around technology, diagnostics, pharmaceuticals, interventions, and so on, right?
Well, if you look at the history of medicine, there have been these incremental improvements in the technology that takes us to better health. One of them you could say was the development of antibiotics. In World War II, the U.S. developed penicillin in conjunction with Oxford in England, and that was a huge step forward. Get a bacterial infection, antibiotics are a godsend. They're a miracle. And prior to World War II, before we had penicillin, if you got an infection, you died. And then there's the development of insulin. Diabetes, type 1 diabetes used to be a death sentence. If you had diabetes, if you developed type 1 diabetes, you were dead within a year, maybe a year and a half. There was no living with it. But then with the development of insulin, people can live whole, happy, healthy lives with type 1 diabetes. So there are certain things that have come out in medicine, stem cell transplants, or sorry, bone marrow transplants for leukemia, surgeries for resectable, curable tumors. I mean, these things have revolutionized medicine and healthcare. And there's certain things that medicine does really bad. Okay. And I would say first and foremost, it's chronic disease. Because with
Right.
chronic disease, medicine doesn't know or even try to cure it. It just tries to ameliorate the symptoms of chronic disease. So you end up with, statins and metformin and antihypertensive medications, which are good for a temporary period of time to help you tolerate the symptoms while you fix the root cause of the problem, but no one ever tries to fix the root cause. So you end up
Right.
just on a statin for the rest of your life or on a antihypertensive for the rest of your life. Like for instance,
Right.
hypertension. I don't know how often it's used in India, but in the United States, about 2/3 of people use mouthwash,
Yes.
which kills bacteria in our mouth, which convert nitrite into nitric oxide, and it leads to hypertension. And no one knows that. They take an antihypertensive medication and then they mouthwash their mouth every day. It's
Yeah.
simple and reversible, right? I mean, they're just not
Right.
making enough nitric oxide because of something they're doing. Statins. You know that statins in high risk patients have this tiny benefit, tiny. And in everyone else, they mostly cause harm. They're fungal toxins that prevent us from making cholesterol by inhibiting an enzyme called HMG coenzyme reductase. The fungus make this because it
Yeah.
kills the organisms that try to eat the food sources that they're colonizing. And we now have spread these statins throughout the world because we think high cholesterol is a problem. Whereas we don't look at, hey, what is the actual real problem here? Is it that maybe we're loading our LDL particles with oxidizable fats? Is it that we're metabolically unhealthy? Is it we're smoking? Is it that we're shearing the blood vessel linings with chronic hypertension? Modern medicine doesn't try to figure that out. They're just like, hey, take this drug, it'll cover up the symptoms and go live your life. That's where
So it's almost like we have become incredibly good at managing disease while chronic illnesses keep silently exploding, right? I'll just double click on the statins aspect. Now, you've mentioned that statins are, if at all they work for extremely high risk patients. But why is it that statins have been propagated by, the top physicians, the best researchers? Why has it been so well propagated and why is it such a common thing among people today?
Yeah. Well, I mean, I think it all starts in the US and it propagates to the rest of the world. And the US is a capitalistic medical economy, very capitalistic driven. I know it is all over the world, but in the US it is the core of medicine to make money. And statins make $15 billion a year in profit. Okay. And we got into this way of thinking many years ago that cholesterol causes cardiovascular disease because they dissected open rabbits that were fed meat. Rabbits are vegetarians, but they fed rabbits a bunch of meat. They opened up their arteries and said, hey, look, we found cholesterol in the arteries. That must be causing cardiovascular disease. And then we had this epidemiologist back in the day named Ansel Keys who went
Yeah,
out and looked
of
at
course.
these countries, these 7 countries, and
Yeah,
he basically cherry picked the ones that had the worst outcomes who ate saturated fat and the ones who had the best outcomes, which ate less saturated fat, and left out all the other countries that
yeah.
would make the data more unbiased. He left those all out. And
Data was
it was
manipulated. So,
manipulated data. It was, and what happened, it was basically an epidemiological study. So you
right.
could look at correlation, but you can't look at causation, right? And so his premise was that saturated fat increases cholesterol and that causes heart disease. And that got spread across the world and became this target for medications. So then a Japanese pathologist discovered that he could basically isolate this statin from a fungus, use it to inhibit cholesterol synthesis, and it just started from there. And since then, every drug is to try to reduce cholesterol synthesis, right? Whereas we know that cholesterol is an integral part of every cell in our whole body.
Yeah.
It is necessary for repair, it's necessary for function, it's necessary for hormone synthesis, it's necessary for vitamin D synthesis. Without cholesterol, you just don't function properly. And the reason you find cholesterol in diseased arteries is because cholesterol is being delivered there to try to repair them,
Right.
right? So you find a paramedic at the scene with blood on their hands and say, "Oh, you killed the person." I mean, that's essentially what's happening, right? Now let's make a drug for that, and let's make another drug for it, and another drug for it. So back to the US, we got this capitalistic society that where all the drug development is occurring, and they're creating drugs to try to inhibit cholesterol and then basically misleading the public and the doctors on the results, printed on these shiny pamphlets handed out in
Right.
every clinic. And next thing you know, that propagates to the rest of the world that, hey, you got to take statin to reduce your cholesterol or you're going to have cardiovascular disease. And what's happened? We haven't reduced cardiovascular disease at all. It's just gotten worse, you
Right.
know?
And plus it has a lot of downstream effects as well.
Yeah. So it inhibits the production of coenzyme Q10, which
Yeah.
is essential part of your mitochondrial machinery, the
Mitochondria.
electron transport chain. So you can't make
Absolutely.
energy properly. It inhibits the production of heme A, which is a compound that also sits in the electron transport chain and prevents proper energy production if you don't have enough of it. It inhibits the production of vitamin K2. Vitamin
Right.
K2 is the cousin of vitamin K1, and it prevents the calcification of your arteries. And it actually promotes the calcification of your bones so you have better bone structure. And so people on statins, they've shown this in clinical studies, people on statins get calcification of their aortas because
Right.
they're inhibiting the production of K2, which keeps the calcium out of the artery walls.
Yeah, this is a problem, right? You try and say that I'm fixing one problem, you give five other problems.
Yeah, exactly.
Coming to fatigue, metabolic dysfunction, inflammation, and of course, obesity and diabetes. Today, we are seeing these issues appear earlier and earlier, especially in countries like India. Why do you think that is?
Yeah, I mean, it all comes down to energy production, right? All these symptoms you've talked about, fatigue, maybe some people have brain fog. They're not their same cells that they were back in their 20s. And they think, "Oh, I'm just aging." But it's all comes down to metabolic health. So, metabolic health basically describes how efficiently you produce energy. And when you become insulin resistant, which happens when you put on weight, when you basically eat a very high carbohydrate diet, your body basically makes your cells resistant to insulin. And if you're resistant to insulin, you can't get glucose into the cells. It stays in your bloodstream. That's why you get high glucose numbers
Yeah.
on your blood sugar tests. And the cells are essentially starved for energy at the same time. So you get low energy, you get brain fog, you get inflammation in your joints, you get inflammation in your arteries, you get inflammation in your kidneys, you get inflammation in your eyes, you get inflammation in your skin. It just leads this problem with not being able to get glucose into the cells because you're counterintuitively taking in too much energy is the
Right.
root of almost all these chronic disease problems. Now you add on top of that unhealthy lifestyle choices like not moving, being sedentary or smoking, and you just set the stage for this degenerative chronic disease picture.
So, coming to things like fatty liver disease, cardiovascular disease, infertility, autoimmune illnesses, even anxiety and cognitive decline, do you see these as separate diseases or are they increasingly different manifestations of the same underlying condition?
Yeah, I think you're right, Anil. They are separate manifestations of the same underlying problem, which is this degenerative chronic disease state that comes from poor metabolic health, you know?
Hmm.
So let me give you a good example of how one disease state can lead to multiple chronic problems. Okay.
Right.
Let's say you have diabetes or you're pre-diabetic. You don't even have to have diabetes. Over the next 10 to 20 years, you're going to develop kidney disease. You're going to develop heart disease. You're going to develop peripheral artery disease. You're going to get inflammation in your joints. So you're going to develop osteoarthritis, which is inflammatory. You're going to develop brain fog first, and then you're going to start developing basically early cognitive impairment. They call it mild cognitive impairment. And then that's going to lead to Alzheimer's or some type of dementia. And these problems all march on top of each other, and they're all related to the same problem that you are insulin resistant. You are not metabolically healthy. And here's the thing, that's 100% fixable, even without medications. I mean, people don't realize that they're like, well, I got diabetes, I got to take a medication, and I'm going to have diabetes for the rest of my life. I'm like, well, no, you can choose if it's not type 1 diabetes, which is autoimmune. If it's
Right.
type 2 diabetes, you can cure it with diet and lifestyle. And if you look back to your great grandparents' generation, no one had type 2 diabetes. Like,
Yeah.
I mean, it was a rarity, a curiosity if someone
Right.
developed type 2 diabetes.
Right.
None of no one had it back then.
So you would say that this is all lifestyle driven.
It is lifestyle driven. I mean, it's lifestyle driven, it's environmental. I mean, we've got toxins around us that we never had before. We can still live in that environment, but we have to basically treat our bodies the way they were evolutionarily designed to live. So, for instance, let's say you look at 2 meals. Let's just go to food because I think exercise is another one we can talk about, but let's go to food. Your great grandparents, if you're living in India, likely had a meal that was based on millets, not white rice. It
Right.
was based on, pulses and meats. And then their fats, they didn't have vegetable oil. They didn't have, sunflower oil or peanut oil or canola
Right.
oil or corn oil. They didn't have any of these seed oils. They had ghee, they had
Yeah.
animal fat, and they had coconut oil. And then they had a little bit of mustard and sesame oil that
And
they'd use
sesame.
for, yeah, that
Yes.
they would use for seasoning, right? Now you get a plate, and instead of millets, it's white rice, which is very high glycemic index.
Polished white rice.
Polished white rice, yes. No fiber and nothing. And you've got a chicken curry that's cooked in sunflower oil, is
Right.
loaded with sunflower oil instead of, you know, ghee or, coconut oil. And then you've got another dish that's fried in some kind of seed oil. And you're basically loading your body with oxidizable fats that your
Right.
ancestors never had access to. And you're loading your system with rapid release glucose through these refined starches. That's a totally different metabolic picture than what our ancestors had.
Yeah.
And it shows in how you look. You look in the mirror and
Yeah.
you're a man that has breasts, or you
Yeah.
have this big belly, you don't you look at your arms and they're skinny. When you're young, they were robust, You look at a picture of your great grandfather and he was this old man, you could see his six-pack stomach
Right.
and the striations of his muscles in his arms? And so that's the difference between then and now, it's diet and lifestyle. Your
Yeah.
great-grandfather was working he was walking behind a plow every day, or he was, doing maybe he worked a non-labor job, but he was still super active every day. He walked to the office and back every single
Right.
day. There was no auto transportation. So he's walking, he's eating healthy, and you're not. And that leads to this
True.
state of chronic disease and metabolic dysfunction.
Yeah. One thing that feels particularly alarming is how early this decline now starts, right? You see teenagers who are pre-diabetic, fatty liver disease in youngsters in their 20s. Why do you think that is?
It's the same thing as diet and lifestyle. A child having type 2 diabetes is like unheard of even 30 years ago. Okay.
Right.
Now it's an epidemic.
Yes.
These kids who are morbidly obese, insulin resistant, when they should be at the prime of their health, is just something we've never seen in the history of mankind. And it all comes down to diet and lifestyle. These kids are eating highly refined foods. They're eating a whole load of oxidizable fats because all these processed foods have these seed oils in them. They're not getting exercise.
Yeah.
They're exposed to all these phytoestrogens and xenobiotics in the environment from plastics and perfumes and scents and all these things that human beings never had access to because they're created in a factory. They're not natural. And
True.
their bodies just don't know what to do with it. They end up in this state of metabolic dysfunction that follows them for the rest of their life.
And one of the most dangerous things about metabolic disease is that people can feel mostly fine for years. Why is metabolic decline so silent in the beginning?
Yeah, because, well, I would say that those people still know that they're not in their optimal state, especially if they were healthy before they developed their metabolic disease. So, I mean, you could say, if you're 40 and you are low energy and you have, breasts and you have a big belly and you've lost your muscle mass, you know that you just don't feel good. You go out in the soccer field or football field and you pull you pull your glute like in the first 2 minutes and you're winded after a minute. And you know that you used to run that field all day as a kid and you can't do
Right.
that anymore. You also know
Right.
that even though you're established in your career at this point and you're respected and all this stuff, you know that cognitively you're not at the same capacity that you were when you were 20, when you were 24 coming out of college and you were just acing all the tests and you could just think about things all day and solve problems and not have any mental fatigue. And now, even
True.
though you spent time establishing yourself, you're not the cognitive person you used to be. So
Right.
I do think people know, but they're
Hmm.
complacent. It's not something that is so devastating that you're going to stop and change most of the time. So they just live
Right.
with it. And then there's these ticking time bombs that are going off. Their kidneys are slowly degenerating. Their hearts are slowly degenerating. Their brains are degenerating. Their sexual functions degenerating. Their skin's
Right.
degenerating. Their joints are degenerating. Their liver's degenerating. They're developing fatty liver disease. All these things are happening slowly. So it's like the frog in the boiling water, right? You put the
Yeah.
frog in the water, it's normal temperature. He's fine. And you slowly heat it up. And that
Right.
frog never jumps up. He just boils in place because he doesn't realize he's in trouble.
Then there's also this misconception that someone is healthy if they're not visibly overweight. We now
Yeah.
see people who appear thin externally, yet they have fatty liver, metabolically unhealthy internally. Why is that happening?
Well, they do have fat. They just genetically put it on inside their peritoneal cavity and in their liver and in their muscles as well. So, we're all genetically a little different. Some people store fat in their subcutaneous tissue very easily and in different parts, right? Oftentimes you see women, they put it on in their bottoms and in their thighs, and men they put it on in their guts. But are people who put it on in their peritoneal cavity. That's that sac that surrounds all the organs. And if you
Right.
do an abdominal surgery on them, you open it up, it's just full of fat in there. And that fat is very hormonally active, creating insulin resistance throughout the body. It's actually releasing estrogens that go and lock down the cells and prevent them from absorbing glucose. So may look thin, but they're not. They have this fat tissue on the inside that's creating problems. There's another thing. None of those, you can look at anyone and decide how metabolically healthy they are, regardless of fat content on their body, by how muscular they are. And
Right.
these thin folks who are metabolically unhealthy, they have no muscle mass. They are
Yeah.
you put them in the gym and they can't lift weight, or you put them out to do some manual labor, they can't do it because
Hmm.
they just have low muscle mass. And muscle is the most metabolically hungry tissue in our body, except for our brains. So
Right.
yeah, that's I would say looking at someone's body habitus by fat is less equivalent to, looking at their muscle mass. If they have healthy muscle mass, even if they have quite a bit of subcutaneous fat, they're likely much more metabolically healthy than that thin person who has no muscle mass.
True. Muscle is also the glucose sink, right?
It is.
So,
Yeah.
yeah.
That's why I tell all my patients after you eat, if they're struggling with metabolic disease, after you eat, go on a 15-minute walk minimum right
Right.
after you eat. And if
Yeah.
you do that, this glucose spike you're getting from a meal, it gets sucked into your muscles
Yeah.
because your muscles are working. They're calling for the glucose, and you can actually bypass the insulin resistance through a different mechanism that calls glucose into the muscle cells. It's a really cool piece of physiology. Walking 15 minutes after a meal is more effective than metformin. And it's free and it's got no side effects. It's got side effects that are beneficial for you. So I highly recommend walking. I know in India it can be very hard because of the traffic and especially in the urban
Yeah.
areas,
But
but
you could always squat, do a few squats wherever you are.
yeah, you can do some push-ups, you can do squats, you can walk around
Yeah.
your house for 15
Yeah.
minutes. It doesn't matter. You don't have to be outside. You just have
Absolutely.
to work your muscles. And walking is usually the lowest like barrier to entry for most people.
Now, how connected are metabolism, inflammation, and brain health? Because increasingly it feels like, the body doesn't separate these systems the way medicine does.
Yeah, well, they call like Alzheimer's type 3 diabetes because you get this insulin resistance in the brain cells and you
Mm.
get hypoperfusion of the brain because the arteries there are being occluded by constant inflammation and disease. So, yeah, metabolic disease, inflammation, and brain health are all in the same, like basically circle on that Venn diagram. They are intrinsically linked. And so, if you are metabolically healthy, your inflammation is low and your brain health is good. If you're metabolically unhealthy, you have systemic inflammation and your brain is slowly deteriorating.
Right. Someone listening to this and wants to understand their long term health risk early before disease appears. What should they actually start paying attention to?
Yeah. So I think the first thing is get your hemoglobin A1C checked. So that is this marker of basically long-term glucose levels. So one of the ways that high glucose in your bloodstream causes problems is it sticks to things. It's called agglutination, and it likes to stick to proteins. It likes to stick to lipids, but when it sticks to them, it causes those tissues to dysfunction. They can't function properly. And every tissue, every molecule in your body has a function. It's there for a purpose. And glucose kind of just cruds it up, it makes it unfunctional and alters its shape and it causes all sorts of problems. That happens to the hemoglobin in your red blood cells as well. And we measure the percentage of your hemoglobin that has agglutination, and it's called hemoglobin A1C. You need to
Right.
be below 5.7% on that test. Okay.
Right.
Lower is better. So if you're at 4.8, that's fantastic. But if you're above 5.7, you're getting into prediabetes. And if you're above
Mm.
6.5, you're diabetic. So I would strongly encourage everyone to check that, have their doctor check that one test, and then follow that and make sure it's below 5.7. If you're doing that, you're doing pretty good. The other test you can check is the triglyceride to HDL ratio.
Right.
And this comes out on your lipid panel. And this is a marker of metabolic disease as well. So for a man, if it's above 2.0, for a woman, if it's above 1.7, you have basically metabolic disease. So when you get metabolically healthy, your triglycerides drop and your HDL goes up. And
Right.
HDL is the lipoprotein that transports lipids back from the target tissues to the liver for reprocessing. So it kind of pulls cholesterol out of where it's not needed anymore. And triglycerides are this form of floating fat. And we attach lipids to a glycerol backbone and it floats around in our bloodstream attached to our albumin and other proteins, but it's basically a form of floating fatty energy.
Right.
When you eat a high carbohydrate meal, it gets turned into fat. Most of it gets turned into fat and attached to these glycerol backbones, and you get these high triglyceride levels. So when you start bringing down your refined carbohydrate load, your triglycerides go down. And so once you get below 2.0 for a man, below 1.7 for a woman, you're in this metabolically healthy range. So those are the two ways I would check. There's some other things called HOMA, IR, and those are more complex, and I don't think you need those. The triglyceride to HDL ratio and the hemoglobin A1C are the most important.
I think what you're saying is at least have these two as your initial markers to ensure that you are metabolically healthy. Now, what about sleep? Sleep seems to sit at the center of almost everything: metabolism, recovery, hormones, brain health, and of course, even your emotional regulation. Have we massively underestimated the biological cost of chronic sleep disruption?
Yeah, absolutely. Without sleep, you die within days. It is a form of sleep deprivation is a form of torture used by governments around the world. And the
Right.
human being has to sleep to function and not just to function, to stay healthy. So without sleep, your whole body falls apart. I mean, and every animal's like this. These birds that migrate across the world, they
Right.
sleep while they're flying half their brain at a time. Dolphins in the ocean, they go up there and they have to come up to the surface to breathe, right? Because they're mammals. They need to breathe air. And so they'll sleep half their brain so their other brain can look out for predators and also guide their bodies up to the surface to breathe and then go back down. And so sleep is the one thing you cannot compromise on in this world. Now,
Right.
what happens is we live in this world where productivity is valued over less productivity. So if you get the recommended 78 hours of sleep per day, and you got some guy who's getting 3 hours and working twice as hard, that's valued, even though his work might be garbage compared to
Right.
yours because you're well rested. And so we push ourselves to sleep less and work more, which creates stress and poor metabolic health and poor neurological health. Everything just falls apart when you're not sleeping. And sleep
Right.
is also very important for preventing neurodegenerative disease because we have this system in our brain called the glymphatic system. And you've heard of the lymphatic system in our body, right? It flushes
Yes.
toxins outside the vessels through these interstitial spaces. That's the spaces in between cells. and into this basically organ called the lymphatic system that dumps into our venous blood and then gets cleaned by our liver. Well, in the brain, that lymphatic system doesn't go up into the brain. It stops at the blood-brain barrier. And instead, we have these channels that open up between our brain cells called the glymphatic system. And it only opens up during deep sleep. So if you're not getting deep sleep, which is typically after you've got your initial portion of rest for the night, you don't open up your glymphatic system and you don't flush out the beta amyloid plaques. And you don't flush out the alpha synuclein and the tau tangles. You don't flush any of that out. And so these accumulate, create inflammation, and potentially neurodegenerative disease. The exact mechanism is not totally understood, but we know that you need sleep to open up your glymphatic system and flush your brain out.
Talking about sleep, what about stress? Stress today is very different from what we were all, I mean, what humans evolved for. It's not short bursts of physical danger that we encounter today. It's constant psychological activation. What does that kind of chronic nervous system overload do to the body over years?
I mean, it breaks it down. That's exactly what it does. So stress was meant to come in short bursts, right? You're running away
Right.
from the tiger. You're in a battle for your life, or you're sick and you just need to push through and heal. That's when stress is advantageous because it mobilizes glucose for energy consumption. It it basically churns off the functions that you normally use during the restful, calm periods of your life. And it just basically prepares you for battle, right? That's what stress does. It prepares you for battle. You can't be at war all the time. If you are, your body is broken down because you're trying to get through this survival period so then you can rebuild. But what if you're in this survival period for 3 decades and you never rebuild?
Mhm.
That's when you get destroyed. And that was happening to me. I mean, I told you my personal story in the beginning. I
Right.
was I was falling apart and I had to stop everything and go and rebuild myself in the mountains of southern India to come back
Yeah.
as a whole person. I hadn't had that. I had had sleep deprivation. I had had chronic stress and I was always under the gun and I gave it all up, despite the financial injury and the productivity injury and all my family saying, don't do this. You're an esteemed neurosurgeon, respected neurosurgeon. Why would you do something like this? And I said, because if I don't, I can't be a neurosurgeon anymore. I'm just telling you right now. So I'm not telling people they have to go quit their jobs and move to a different country to get unstressed. That you don't have to. There's other ways. For me, that was the one that worked and I had tried a lot of other things and they just weren't helping me. But there are methods. You can make a change locally. You can get a different job. You can move to a different house. You can make different friends. You can meditate. Meditation is
Right.
extraordinarily valuable. I
True.
never really realized the value of meditation until I started doing it. And then I was like, wow, I can't believe how effective this is. I like yoga nidra, these breathing exercises. So, but you do what works for you and everyone's a little bit different. The
Right.
other thing is investing in things other than your career. We always just invest so heavily in our career because we're so driven as human beings. That's what human beings they do. They go out and they build and they try to move ahead in the world. But sometimes to actually really move ahead, you got to invest in some things that don't have tangible financial or notoriety to them. You have to go and invest in things that bring you joy, bring your family joy, like relationships, hobbies, sports, travel, food, whatever it is, you go out and you put your time into it. For me, a big part of it was service. I went and volunteered in these mission hospitals in helping people who would have otherwise not been able to find help in the worst times of their life. Gave me such great joy and fulfillment. And that is something that you can find, but you have to let go of the pretenses that you've created that drive you into the state of perpetual stress.
Wow. That's beautiful. Well said. As a neurosurgeon, how do you think about the relationship between brain health, mental health, and physical health today? Because increasingly, they don't seem to be separable.
Yeah. No, I mean, mental health is an epidemic in the US, and I know it's a big problem in India. And brain health is the same. They tend to be striking people at different ages. the neurodegenerative diseases are coming later in life and the mental health diseases are coming earlier in life. But I think they're spectrums of the same problem, Anil. They are depression is likely neurological inflammation.
Right.
And neurodegeneration, like Alzheimer's, is the end consequence of prolonged neurological inflammation. So if you're depressed early in life, that's a red flag right away that, hey, you're not living right. You have some inflammation that's affecting your neurological system. You need to fix it now so that it doesn't follow you later in life to neurodegenerative disease. So I think they're all combined, they're all part of the
Mhm.
spectrum of neurological inflammation. And it's definitely obviously it's more apparent early on because young people or middle life people who are depressed, it wrecks their life, but it could be a blessing, honestly. It could be a blessing that, hey, now's the time to fix things.
Right. Now, when we say neurological inflammation, is it more to do with the stress, or is it more to do with your lifestyle? Is it more to do why are we seeing these problems even in younger populations today?
Yeah.
Do you think our modern nervous system is overloaded?
It definitely is overloaded, but not just by stress. It's overloaded by the metabolic injury that we're causing through the types of foods and the lifestyle that we lead. It's overloaded by toxins. It's overloaded by expectations that never were there before. I mean, kids waking up at 5 in the morning to go to school, 6 in the morning, 7 in the morning. A
Right.
child needs most children need 10 to 12 hours of sleep. And we're locking them in at 7 hours and thinking that's normal because they gotta go get the best grades they can. We are just pushing and pushing and pushing against our natures, Anil. And it's just the societal push that ends up taking us down in the long run. So let's say let's give an example. You have a young person, they're depressed. First of all, you get professional help. Okay. You need to talk to a psychiatrist, pediatric psychiatrist, family doctor, whoever's there to help you. And you start with that. But you got to make sure that child has proper sleep. You got to make sure that that child doesn't have stress that is unreasonable. Okay. You might compare them to the 20 other kids who are going to that, waking up at 6 in the morning, going to school all day, coming home, studying till 10 p.m. and say, well, they're doing fine. Maybe my kid should do that too. Well, no, first of all, those kids aren't doing fine. They may not be having the same outward symptom as your child, but they're still suffering. They're still being worked against their biological needs and their natures.
Right.
So the first thing I would say is make sure your child's getting adequate sleep. Make sure that their stresses are not overzealous. Make sure
Right.
that they know that the love that you give them is not dependent on them performing at a certain level. Just doing that off the bat will do work wonders. And then you work on their diet. Make sure they're not eating the candies and the processed foods. Give them the whole nutritious food that their ancestors ate for millennia.
Got it.
Give that to them. Let them have that. Don't give them the industrial fats that oxidize and create inflammation in their brains because the brain is majority fatty tissue. Give them the healthy fats. Give them the bengayene, the coconut oil, the
Yeah.
ghee, the healthy animal fats that their ancestors ate for so long, and let them develop without their cognitive minds, their personalities, their passions, their interests. Let them develop that without the pressure of you have to be this now or you failed in life. That is a recipe
Right.
for disaster and sets up a lifelong habit of overstress and neurological inflammation.
So what I'm hearing you say is brain fog or difficulty focusing among kids, low mental clarity, cognitive fatigue. These are all not just psychological, but deeply metabolic and inflammatory too.
Yes, absolutely.
Right.
Yeah. I
Right.
mean, you start with sleep, go to stress, go to diet, go to exercise. I mean, if your kid's not on the football field or playing cricket every day, they should be. That almost should be priority over schoolwork. I'm not joking. And I know there's a bunch of families out there saying Dr. Kumar's crazy. But no, you guys, I'm
Yeah.
telling you right now, young body that doesn't move, that doesn't sleep, and that's overstressed is setting up for a lifelong, basically difficulty against metabolic disease and inflammation. And their priorities will be set wrong. They'll end up having
Right.
kids and they'll push them overzealously in the wrong
Oh
direction.
yeah.
So, this is the thing is like we have this mindset that if we don't do things a certain way that we failed. It's dogmatism, right? We have it in religion, we have it in politics, we have it with raising our kids, we have it in all over the place in our friendships and relationships. Sometimes you got to let go of dogmatic beliefs and let nature show its true self because our kids, our children, they're our legacy. They grow up and we pass away and they carry on in
Right.
this world with the values and the principles that we want them to have, but they're different people. And so
Yeah.
we've got to let them develop that on their own, but also learn the healthy habits that keep our legacy and our children healthy and happy and their children healthy and happy. And right now we're breaking that. We're definitely breaking that with all the lifestyle things that we're imposing on them.
Right. Do you think we are simultaneously overfed, undernourished, and overstimulated and exhausted at the same time?
Yes, I mean, I think and you don't need a doctor to tell you that. I mean, you can go ask your your friend, and say, "Hey, do you think that?"
Right.
And they're all gonna say, "Yeah, absolutely." So why don't we
Right.
stop, Anil? Why if we all know this, why don't we change it? Why don't we eat better? Why don't we stimulate ourselves less with screens and all these, digital basically things that keep our minds locked into this state of hyper focus on unimportant things? Why don't we just sit back and enjoy being around people and people we love instead of working so hard? I don't know why we do that, honestly. But
Right.
it's definitely a cycle that perpetuates itself over and over. And I'm not immune to that. Believe me, I'm not telling people, hey, I don't do this, so you shouldn't do it. I do it too. But
Right.
take a look at your life and figure out how you can be more in tune with the way that you were supposed to live in this world. And I think the best way to do that is look at your ancestry, right?
Hmm.
So your ancestors were getting daily exercise. They were eating super nutritionally dense foods. They were not, maybe there are certain places where poverty caused protein malnourishment or like famine or places where there was problems. But for the most part, human beings find ways to be nourished when they're eating whole foods. They were not overstimulated. They were talking, playing games, telling stories, listening to music. They were doing all these things that generally enriched our brains.
And
And
they were
then
not overfed for sure.
and they were not overfed. Well, and even if they did have food often, they had excess food,
Yeah.
they were still not overfed because they ate until they felt nourished and they stopped. We have a
Right.
different type of food that makes us overeat and not feel nourished. It's a big problem. We can talk about that if you want, but the
Yeah.
it comes
Yeah.
down
That's
to
the whole. Yeah.
protein content in our food. We're looking for a
Yeah.
certain amount of protein and we eat these refined carbohydrates where all the protein's stripped out, eat and eat and eat, trying to get the right amount of protein. But yeah, I mean, it is something that everyone can fix. I know that's what you're working on. People come
Yeah.
to you and you teach them how to do this. I think once you build the
Now,
patterns, it's much easier to perpetuate going forward. It's just hard to get there in the first place, especially without help of someone, because doing things on your own with your own conviction and your own doubts is very difficult. So that's why it's good to have someone to help guide you on that.
right. You spent years dealing with spinal conditions. You've spoken a lot about ancestors. Humans evolved to move constantly. What happens to the spine and the nervous system more broadly when movement disappears from daily life?
Yeah. I mean, you're right. The human body was meant to move. In fact, when you stop moving, you start dying almost immediately. It doesn't matter what age you are. As soon as you stop moving, you start dying. When I operate on my patients, even on their spines, I have them walking the day of surgery. They come out of the OR, they recover from anesthesia, and I want them up and walking because their wounds heal better when they walk. It's counterintuitive, right? You think, oh, you just have this
Right.
incision on the back now. You don't want to put pressure on it by standing and doing these things. But if you don't do that, the wounds start to break down. If you get them up and you
Yeah.
work them, the wounds heal better. They recover faster. Yeah, their bowels start moving. Their minds are sharper. Their pain is less. The human body was meant to move. And the neurological system adapts to your movements. You have a part of your brain, it's right here on the side. It's called the motor strip, and it controls all the motor function on the opposite side of the body. So the left side controls your whole right side, the right side controls your whole left side, okay? When you are very functional, that motor strip actually grows in size. So it
Oh,
becomes
really?
more gyrated, it becomes fuller because your brain is adapting to the increased movement. And when the motor strip increases in size, the frontal lobes, which are contain your executive function and your personality and your mood and all these things. It accommodates that increase in motor size by increasing its collateral connections to the motor strip and coordination of movement. So your whole brain essentially, it gets healthier. So when you have dementia, what happens? Your brain atrophies. You can see it on an MRI scan. It shrinks down. And
Right.
there's all this space in the skull. It's like your brain is just rattling around in there. When you're active, the brain increases in size. In fact, daily walking increases the size of the hippocampus, which is your memory center. They've shown this
Right.
clinically with MRI imaging, taking one group of people, walking them, and one group of people and doing just stretching exercises. And the people who walked after 12 weeks had bigger, larger hippocampuses. So it's all intertwined, right? Einstein, they looked at his brain post-mortem and he had a big knob of brain tissue right on his motor strip, right over the right side. It
Hmm.
was from violin. He was an avid violin player and he would take, a violin's a very complex instrument with a lot of
Yes.
fine motor coordination. And so that was for him to be able to use his left hand to finger the fretboard.
Right.
And how did that play into his overall intelligence? I don't know. It might have played a big role because, the frontal lobes contain a lot of our cognitive function.
That's interesting. Back and neck pain have become almost universal today. Do you think many spinal issues are not just structural problems, but also deeply connected to inflammation and stress? And of course, lifestyle?
Yeah, absolutely. I would say this, Anil. The number one thing I see that causes degenerative spinal disease is smoking by far. So
Oh, really?
smoking, yeah. And I'll tell you why. And it's not just because so you have people in the United States that smoke a lot of marijuana too. I know it's
Yeah.
you have, marijuana in India, but US it's ubiquitous. A lot of states it's actually legal.
Right.
And they won't get degenerative spinal conditions from smoking tons of marijuana. I mean, they got smoke in their lungs all day long, and they're not
Mhm.
getting degenerative spine disease. But people who smoke cigarettes or vape nicotine or use these
Nicotine.
pouches, they have these nicotine pouches people can put in their mouths. They develop degenerative spinal disease. And the reason is that nicotine, which is the active ingredient in tobacco, it causes the vessels to pinch down. It's called vasoconstriction. And so the tissues don't get adequate all the tissues throughout your body don't get adequate perfusion. That means you don't get
Right.
enough blood flow, which delivers glucose and oxygen and all the micronutrients you need to maintain the integrity of your tissues, right? So now the spine, I mean, there's all these bones, there's all these joints, and it's a very dynamic organ. You can move in all the directions, and it's constantly being micro injured, and that's okay. You go in there and you fix it, right? Now, what happens if you don't have the nutrients to fix it? All right?
Uh,
It doesn't repair itself.
Heal. It
It
doesn't
doesn't
heal.
heal. Even these micro injuries, and those blossom into larger injuries. And you get injuries on top of injuries that are not healed properly, and you get this degenerative spine disease. And I think that's likely the leading cause of degenerative spine disease, at least here in the US.
Yeah, I never thought of that. I never thought smoking, and I never connected the two actually, smoking and
Yeah.
spinal conditions.
Yeah.
Now, as a surgeon, you're talking about surgeries. As a surgeon, did it become frustrating at times to see people eventually require intervention for conditions that may have begun years earlier through lifestyle, posture, inactivity, or
Yeah.
chronic stress?
Yeah, I mean it is. That's how I make my living is taking care of these people who don't take care of their bodies and they end up to this point where the only option is surgical intervention. And it is sad and it's frustrating, right? It's because that didn't have to happen. It was an optional problem. That's the way I see it at least. But now they're here and they're suffering and I take care of them to get them back to that state of pain-free living, but I always tell them, listen, you got to stop smoking. You got to take care of your metabolic health. You got to lose weight. If you don't do that, you're going to be seeing me again in a year.
Mm.
And then we're doing this
Right.
all over at a different level. Yeah. Because there's basically 24 bones in the spinal column.
Yeah.
There's 24 bones in the spinal column and each one has two joints on a joint on each side. So
Yeah.
there's all these places that can go wrong in the spinal column and when you're not taking care of yourself, that's a very common problem.
Yeah. Now, a lot of people feel trapped by genetics. You hear them say, there's diabetes in my family, heart disease in my family, dementia, even obesity. How should people think about genes versus lifestyle and environment?
Yeah. So this is how I would think about it. You're not trapped by your genetics. Your genetics, if they were a death sentence or a guidebook for making an unhealthy human, they would have been weeded out of the gene pool long ago. Believe me. Evolution is ruthless for getting rid of genes that cause problems. So whatever your genetic makeup is, it was selected for at some point over millions of years, honestly. Over millions of years, and in human evolution, hundreds of thousands of years. So you're not trapped by your genetics. In fact, your genetics are some type of superpower that you haven't realized yet. What's happening is there's a mismatch. There's a mismatch between how your genes were designed and for the environment they were designed and for how you're living today and the environment you're living in today. So your goal is to figure that out and bring them together because that's when you will shine. You will blossom into the genetic purpose that you were designed for. So if you're
Right.
overweight, you're metabolically unhealthy, your genes aren't the problem. It's the way you're living that's the problem. And figure out how your ancestors lived because they guarantee, I mean, all these people who are morbidly obese in the United States, if they just look back 5 generations, they won't be able to find a single obese person, a
Or
single
even
one.
two generations, I think.
Two
Even just
generations.
two.
Yeah.
Yeah.
Yeah. It's completely amazing how
Yeah.
rapidly we've fallen into this mismatch between evolutionary design and modern environment.
Yeah. Because we often hear the phrase genes load the gun, environment pulls the trigger. Right. But from a scientific perspective, how true is that actually?
I don't think that's true. I mean, that's a nice catchphrase, right? I mean, the
Right.
part where the environment pulls the trigger, sure. But genes loading the gun. So let's take for an example this molecule in a lipid exam called LP little a. It's not in most lipid tests. Most lipid tests don't have it, but it's
Yeah.
something that you should
We do
check.
that.
Yeah.
We
Do
do
you
that.
check for it, Anil?
Yeah, we do.
You do. Okay. So
We check for that.
it's basically controlled by your DNA, right? You can't change the number. I mean, there's some new drugs on the market that may be able to bring it down, that actually do bring it down, but you don't control that number. That number is coded into your DNA. From the day you turn 5 until the rest of your life, it's pretty much the same number. Okay. The problem with LP little a, this lipoprotein, it's linked to like a 2 to 3 times risk of cardiovascular disease. In South Asians, me, you have a
Yeah.
propensity for higher LP little a levels. So
Yes, we
why
do.
would we have that? Why would 1.5 billion people have high LP little a levels? The whole African continent is pretty much has high LP little a levels. Is it that evolution was like, oh yeah, just let them have heart attacks. We don't want them around. No, not at all. There is a purpose for LP little a, and it's that it helps keep your wounds closed when you're bleeding. Okay, because the apo little a protein that attaches to LP little a is a
Yeah. Coagulant.
mimic of plasminogen, which gets converted to plasmin, which breaks down clots. Well, LP little a blocks that conversion of plasminogen to plasmin, so you don't break down your clots. So your wounds stay closed. So if you got
Right.
gashed in an accident 100 years ago and you had high LP little a levels, your wounds stayed closed and you survived. And so it was
Mhm.
selected for because those people were like, hey, these people can heal their wounds way better. The other thing with LP little a is it has this big propensity for oxidized fats. They load specifically onto LP little a. And do you know what the number one thing you need to initiate an atherosclerotic plaque? You can't do it without this oxidized fat.
LP.
Yeah.
Mhm.
You need an oxidized fat that's engulfed by a macrophage. And, oxidized fats are not usable because usually you bring in cholesterol and lipids to repair a wound, an artery wall, if that's the case. And they go in there, repair things. But if they're oxidized, they can't repair anything. And the macrophage comes in there and says, hey, this doesn't look right. Let's eat it. And then the macrophage is like, I don't know what to do with it. So they become
Right.
bloated and they die in place. They're called foam cells and they start
Ah,
atherosclerosis. Okay. So
right.
LPA little a is the biggest carrier of these oxidized fats. But what did our ancestors not have in their diets?
Yeah.
Oxidized fats. They didn't
Yeah.
have them. There might have been a little bit of
Right.
sesame oil or mustard oil in there, which are mostly monounsaturated anyway. But like saturated fats can't oxidize. They don't have a double bond in their carbon chain that can attach to an oxygen and oxidize. They can't. They're impenetrable to oxidation. So if your
Right.
LP little a molecule is full of saturated fat from ghee, because you're not eating corn oil or safflower oil or cottonseed
Yep.
oil, if it's full of saturated fat, those LP little a particles, they go up to the repair area, which is like, let's say it's an artery wall, endothelium, and they repair it because they only have non-oxidized fats, and then they leave and nothing happens. Now, let's
Wow.
say you ate a cup full of sunflower oil. That's the most popular in India, sunflower and peanut oil.
Now there's also a lot of palm oil everywhere.
So palm oil is horrible for the environment, but it's not that bad. It is very similar to coconut oil. It's almost all saturated fat. Yeah. So I would say if you're looking at processed foods, you're going to eat some muraku out of a bag, you know? Pick the one in palm oil, not the one in safflower oil.
Saffron.
But anyway, so yeah, if there is no oxidizable fat in the LP little a molecule, because you're not eating these oxidizable fats, you don't initiate the injury at all. Have you heard this study with Dr. Malhotra back in the 60s with the railway workers?
No, no, I haven't.
Let me tell you that one really good because this is a really
Sure.
cool story. Okay, so there's this guy named Dr. Malhotra. He was an Indian physician, worked for the railway ministries back in India in the 1960s. Okay, this is about the same time that Ansel Keys is going around saying that saturated fats cause heart disease, right? Well, Dr. Malhotra was in charge of this health care of these railway workers, and
Hmm.
half of them were from North India, and half of them were from South India. That's about the time that South India started giving rations to the people, to their constituents, rations of food, and North India never
Right.
got that. I still, a lot of times, I don't think North Indians get rations like South Indians get. But they were giving them peanut oil, mostly peanut oil, which is largely polyunsaturated. And
Right.
it replaced what it did. And they were giving them pulses and rice and all this stuff, but it replaced their normal fats, which were ghee. I mean, in South India, it's mostly ghee and
Yeah.
coconut
Yeah.
oil, right?
Yeah.
Coconut oil
Yeah.
and ghee are the two major fats in South India. The North Indians did not get those rations. They kept eating their own food that they pay for with their own money, which was ghee and animal fat. Okay. So at the time, before the rations started up, the South Indians and the North Indians were all very healthy. In fact, heart disease was a curiosity. Like if someone had a
Hmm.
heart attack, they're like, whoa, we've never seen that before.
Right.
Right. Okay. The rations come. South Indians are now eating mostly peanut oil, and they start having massive rates of cardiovascular disease, just
Wow.
massive rates. In fact, it's an epidemic, and they don't know what to do about it. The North Indians, they're smoking, they're eating tons of sweets, and by all measures, they should be having the highest rate of heart attacks. They still are not having a single heart attack. One group gets switched to seed oils, starts having cardiovascular carnage. The other group stays on their native saturated fats, no problems.
Right.
And that was published over several studies. I think they're all open source, so you can look them up. But that was just brushed away. And this overriding, like basically industrial backed message that seed oils and polyunsaturated fats were the way to go, even though our ancestors had been eating mostly saturated fat. No, I mean, they had to come with the advent of the
Right.
industrial revolution and petroleum. So yeah, anyway, that I thought that was a very interesting story. You got a bunch of other examples, you got people who eat mostly saturated fats out there in the world who don't have any heart disease, and it's very interesting that we keep telling the opposite story even though the evidence just is hitting us in the face, literally.
Yeah, that's true. Do you think one of the biggest mistakes people make is assuming decline is inevitable when biology may actually be far more responsive and adaptable than we realize? Because most people say, "Oh, I'm getting old.
Yeah.
It's going to decline."
Yeah. I mean, this is my thought on it. The human body has this amazing capacity for healing and basically maintaining its systems in homeostasis, which means balance, right? I mean, the whole field of Ayurveda, I don't know if you guys like talk about Ayurveda.
Yeah.
Yeah. So, I
Yeah.
mean, Ayurveda was this all built on building balance, right? That was
True.
the term they used for back then for homeostasis, which is what we say in medicine now, right? And
Right.
you can throw off homeostasis with a number of things. And if you do that, the body can't heal. But as soon as you take away that thing that's basically injuring you every day, the body just starts to heal no matter your age. I mean, the
Mm.
body is a miraculous healing machine.
Yeah.
The Ayurvedic doctors and the ancient Chinese medicine doctors, they had figured that out through observation, right? They didn't have test tubes or lab tests or MRI machines, but they had these
Right.
keen powers of observation. And they knew what uh, body out of balance looked like. and
Mhm.
they knew how to bring it back into balance. And medicine has not been good at that. Modern medicine's not been good at that. We're good at saving your life in an acute problem, broken bone,
Right,
infection, but
right.
bringing the body back into balance and allowing its natural mechanism for healing to take place is not doing it very good, is what I should say.
Talking about modern medicine, for a very long time, medicine viewed chronic decline, especially brain decline, as largely irreversible. Is that conversation now changing? And how reversible or modifiable do you think brain decline is?
Yeah. So once it's started, it's very hard to reverse. It is very hard to reverse. Not that it can't be. I'm not saying that.
Right,
But it's like it's been happening for 20 years already, 30 years, 40 years. That's the problem. We see this, early dementia or late dementia or cognitive decline, and we're like, oh, it's starting. No, it's not starting then. It started a long time ago, and the damage has been going unchecked for decades. So that's why it's so hard to reverse. It's like, seeing the Titanic sinking and only the bow is above water now, and you're thinking, "Okay, let's bring
right.
it back up." The time
Mm,
to bring to keep it on floating on the water is when it first sprung the leak, right? Or first
right,
hit the
right,
iceberg. But so that's how I see dementia. Now, there are certain things that you can do early, as soon as you notice to bring yourself back into optimal health. One is, work on optimal metabolic disease. Eat very healthy fats. The brain is all fat, almost all fat and protein. So eat healthy fats. If you're eating, fried butter and, sunflower oil every day, then stop eating that.
right,
You're in even though Alzheimer's might start on today, you're already in late stage disease. That's the way I see it because it's been happening for decades. No. Now, if you ask me, I think what you really wanted to know was, is cognitive decline inevitable? Is that just where we go? No, heck no. I mean,
right,
our ancestors, they died of other things, right? They died of TB or, some other infection or an injury,
yeah,
right? But they didn't ever have cognitive decline. In fact, that
right,
the few that had made it through the gauntlet of traumatic injuries and infections and made it into their 90s were still so cognitively sharp,
right,
they would be the library of all the history and stories from their generations and telling it to the younger generations without any difficulty. They might have had cataracts from, constant exposure to smoke fires and all these other things, but they were cognitively sharp as fiddles. That's the way the
right.
human mind is meant to age, not with this turning 60 and developing cognitive decline. That is so sad and it's unnecessary.
Now, there's enormous interest around pharmacological interventions. GLP-1s, of course, here, longevity drugs, cognitive enhancers, peptides, supplements. Where do you think the science is genuinely promising, and where do you think the hype is outrunning reality?
Yeah, I mean, these are all like honestly moves in the right direction for scientific intervention into disease processes. This is GLP-1s agonists, which are these drugs like, Manjaro, Zempic, Zepbound. They're are very like they can be miraculous for some people, because a lot of people have dug themselves into deep holes and getting out, they just don't have the willpower, they don't have the know-how, they don't have the support to get out of that hole. These drugs can help them get out of the metabolic hole that they dug for themselves, get back on the stable ground where they can work on the proper lifestyle changes that you and I are kind of preaching here, right? Peptides, I mean, they're just there. There's a lot of science that shows benefit in animal models. There's
So,
not much study in human studies. I mean,
right,
we use peptides. Insulin's a peptide, right?
right.
GLP-1 agonists are
GLP-1
peptides.
is a peptide. Yeah,
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 yeah. I mean, these are all peptides, but these other things like BPC 157 and thymosin, beta, and all these things,
yeah.
they're just animal study. They've been seen in animal studies and very little data in human beings. Okay, so those are experimental. I hope they come about and get brought into clinical trials and understood better because peptides do have active roles in our body. Growth hormones and peptide. I mean, these are all our body gets signaling through peptides. So if we can signal our body with a peptide to do a certain thing that we want it to do, then yeah, that's great. I think AI will be a huge harbinger in the development of peptides and human health because it'll be able to look at large amounts of data and figure out and make sense of them.
Let's talk about the gut and the brain, of course, since you've done a lot of work on brain. The gut brain connection is now everywhere in health conversations. From your perspective, how real and how significant is this relationship actually?
Yeah, so the gut brain connection is real. There's no doubt about it. There's more neurons in your GI tract than there are in your spinal cord. So, and the bacteria in your microbiome and the fungi and all the microorganisms, they secrete vasoactive, neuroactive compounds, neurotransmitters that communicate through the vagus nerve with the brain. They just do. It's verified and validated scientifically. Now, whenever you see someone with an unhealthy microbiome, their whole body and their brain is unhealthy. It is like
Right.
this, you can't be a healthy person without a healthy microbiome. It's impossible. I mean, it is literally impossible. The two don't coexist. So if you said, do I think the microbiome is important for brain health? I'd be like, yeah, you can't have a healthy brain without it. There's no way. So how do you do that? Well, it's complex. And I know this is something you work on with your clients, Anil, but like that I always go for a approach that fits our ancestral traditions. You know, if people often say, "Well, what probiotic should I take?" And I say,
Mm.
"Well, there's a lot of good probiotics out there. There's
Yeah.
research, and you can look at them. But really, your bacteria that want to live in your gut will live there if you give them the right conditions. The bacteria that you don't want living in your gut will live there if you give them the wrong conditions. So you have to
Right.
give them the right conditions, and that's generally a whole food
Yeah.
diet with healthy fats. Same stuff we've been talking.
I think diversity also plays an important part.
Diversity is super important because we never
Yeah.
ate a monolithic diet ever.
Yeah. Yeah.
Like no one ever ate, chapatis and chicken every single day for 2 years,
Right.
I mean, it was always.
And it was also seasonal and you would eat as per the season.
Yeah.
So,
And luckily in India, you have that ability. These markets are always have the vegetables that are in season and local. The US
right.
doesn't have that as much, I mean, we have farmers markets, but we get a cold time of year that nothing grows and we import stuff from South America. We can still be
Yeah.
diverse in our diet here, but India, it is a very doable. And
Yeah.
so yeah, diversity, whole food diet, healthy fats, and fermented food is important. There's no traditional society in the world in history that didn't eat fermented food. It was the main
Mm.
way of preserving food back in the day. It basically became intertwined with human biology. Our
Right.
guts evolved over those thousands of years to be like, yeah, I need fermented food in here. And so let's say like you ferment a curd on your countertop, right? That curd. So let's say, and then you have a probiotic pill. That probiotic pill has like 5 billion CFU in it. That's colony forming
Right.
units, right? So if you
Right.
poured that out and diluted it a certain way, it would grow 5 billion colonies, right? Bacteria. That yogurt in the same amount has like a trillion CFU, like a
True.
more, sometimes up to 1,000-fold more bacteria in that like tablespoon of yogurt. It's totally natural fermented foods are your biggest input of probiotic bacteria. And people always
True.
say, well, should I ferment it a certain way? Should I get, bifidobacterium or
Yeah.
lactobacillus or L. reuteri? And I'm like, no,
Yeah.
let the natural bacteria ferment it because they are there and that's what they're in the natural environment. I'm not saying you can't use a starter culture. If you want to do that, that's fine.
We have a little tradition here on Writer 100 where we ask a rapid fire set of questions. You don't have to think too much. Just answer with, as I say, with your gut.
Okay.
One health belief you've changed your mind about over the years.
That saturated fat is bad for you.
Most underrated pillar of long-term health.
Sleep. Good sleep. I mean, good quality 7 to 8 hours of sleep per day.
Right. One modern habit quietly damaging human biology.
Chronic stress.
What do you think is the most overhyped trend in health right now?
Yeah, I would have to say taking metformin for metabolic disease when you can actually just cure it with diet and lifestyle within weeks.
One thing people should start doing early for their brain health and longevity.
Yeah, social connection. It's not something we talked about much in this podcast, but social connection is crucial. The other thing is making sure as you get older that your hearing is proper because people who start to lose their hearing have much higher rates of dementia.
Finally, what does living well mean to you?
Living well is living a happy, whole, spiritually and emotionally full life. Without that, what are we doing? All right. Are we just going through the motions to put money in our bank account or tallies in our notoriety in society? No, we want to be there in the fullest, best way we can for all the people who love us and all the things that are important to us. So yeah, that would be it.
Great. If you had the biggest billboard in the world, what message would you put on it for the rest of the world to see?
Live like your ancestors.
Dr. Kumar, I think what makes this conversation so important is that it reminds people that chronic disease is not just about isolated diagnosis, it's about how modern life interacts with human biology. Thank you so much for that conversation and all the great information that you've given me and to my audience. Thank you.
You're very welcome.
If you enjoyed this episode, share it with someone who's been struggling with their health, energy, sleep, stress, or simply trying to understand what's happening to their health today. Because the reality is, many chronic diseases begin silently long before diagnosis. And the earlier we understand our biology, the greater our ability to change the trajectory of our health span. Thank you for listening to Brighter 100. Until next time, stay curious, stay aware, and take care of your health before your body is forced to ask for it.